I'm Dr. Tracy Stecker, and welcome to the Choosing Help podcast. Choosing Help presents conversations about courage, connection, and the transformative power of asking for support. Through candid discussions, expert insights, and real-world stories, this podcast breaks down stigma and opens doors to understanding. Join our community committed to compassion and courage, because when we choose help, we choose life. Welcome to Choosing Help. This is Dr. Tracy Stecker, and I'm joined today by Dr. Teresa Kelechi. Today, we're going to talk about loneliness and the impact that loneliness has on our physical bodies, our physical health, and even our abilities to heal. Loneliness is when somebody feels alone, and that's regardless of whether they're surrounded by people or truly alone. And it's linked to a lot of bad outcomes, including dying early, lots of increased risk of chronic disease, including stroke, high blood pressure, heart disease, diabetes. It's linked to inflammation, high cortisol levels, stress. It's linked to a weaker immune system. It's linked to an increased risk of dementia, depression, anxiety, and it's linked to slower healing. And so Dr. Kelechi, my guest here with me today, a wonderful woman. She's an award-winning nurse, professor. She's the Associate Dean of Research at the College of Nursing at the Medical University of South Carolina. And her expertise has been in her career focusing on ways to help healing and reduce pain. And she noticed in her work that healing could take different paths. And one of the things that she noticed is that those who were so socially isolated and alone took longer to heal. And she thought, well, let's figure out what was going on there. So, Teresa, do you mind telling us a little bit about your work, what you noticed, and what you found?
I sure would. Thank you, Tracy. I'm going to call you Tracy, Dr. Stecker, for inviting me on the show. This work is something that I have been interested in for 25 years, but I didn't know what it was.
Yeah.
So I had a wound clinic. I saw in outpatient setting here at Medical University of South Carolina in Charleston. And I saw predominantly people who had lower extremity ulcers, mostly venous leg ulcers or diabetic foot ulcers.
Okay.
I was perplexed with a group of patients who would come in and everything was right about their wounds. They
Hmm.
were clean, they weren't infected.
Hmm.
The patients seemed to be doing what they were supposed to be doing at home with elevating their legs or keeping, their foot from walking around on the bare floor. And I was talking to a patient one day about other research I was doing for wound prevention. He said, "You're studying the wrong thing. You need to be studying loneliness."
Mm.
I'm like, I had no idea that that was a thing.
Hmm.
And then I started looking in the literature, being kind of a clinician at the time and not a researcher. I hadn't received my PhD yet, but I read about the influence of loneliness. It's been studied in some capacity for 50 to 60 years. As you know, you do intervention work with loneliness. So I actually did a sabbatical to learn more about the social aspects of what we call social genomics and what that science means for loneliness and how could I include it into my clinic patients as well as into my clinical care as well as studying it. So it became a big deal in my research
Yeah.
and found that there is a link with this thing called social genomics. So being lonely affects your genes, which
Yeah.
are kind of your body's blueprint, or it's kind of like the manual, the instructional manual. That doesn't sound very research oriented, but every day we have genes that express for things like inflammation and immunity and growth factors. and we found a link between loneliness and these particular set of genes. So
Yeah.
went on to conduct the research, and I can talk more about like who I ended up in my research team, which was kind of fascinating, but I want to make sure I answer your question first.
You did, and I'm very curious about your next steps.
Oh,
Please.
okay. So I looked at how you study loneliness, and
Hmm.
we weren't sure how the genomics worked. And genomics is study of sort of the environmental aspect of how everything from where you live, the geography, the climate, where what you eat, so to speak, but more or less your social connections.
Hmm.
So we applied for National Institutes of Health funding to explore the biology of healing through a social genomics framework.
Okay.
That means is I needed to have somebody on this team who understood and had experience with social genomics. And I reached out to a colleague. I never met him before. His name is Dr. Stephen Cole. He's at UCLA. And he already had been studying adversity and its relationship with different aspects of health. Well, I
Hmm.
wanted to apply what he had learned in this, it's called the conserved transcriptional response to adversity pathway. And this has to do with when the body is subjected to prolonged stress, which would be non-healing wounds or loneliness.
Hmm.
There's a shift in sort of this harmful mode towards genes being dialed down that allows this chronic inflammation to take place. And if the body's inflamed, and when I say body's inflamed, that means the skin is inflamed, the tissues are inflamed, then the wounds won't heal because the good things that need to get in there can't penetrate to the cells that need the oxygen and the red blood cells that are important and the white blood cells to heal.
So
So
I'm sorry, I just want to make sure I understood that. So when the body's under stress, the genes are dialed down. The genes that we need to be activated, those get dialed down. And then
yes,
we have chronic inflammation and the body system can't work effectively. And so you're inflamed, the circulatory system, everything is not sending the healthy stuff
right. Yeah,
in.
exactly. Yes, that's perfectly stated. So, in wound healing, when wounds happen, and these are what we call chronic wounds, chronic leg ulcers, chronic diabetic foot ulcers, ulcers should heal in about a month.
Okay.
These wounds, or we call them ulcers or wounds, kind of interchangeably. Before these patients got into the specialty wound care, they'd been open for like 30 months.
Wow.
And we throw everything at them that we have. We had advanced technologies. The patients were getting exactly what they needed. For example, you see those compression stockings. They have
Hmm.
to wear those to keep the fluid out of the legs so that the good circulation can get in. They need to elevate their legs.
Hmm.
We use specialty wound dressings on them. And for patients that are not, they're not like being they're not healing in response to those therapies. We were trying to figure out what else is there. So we assessed them for loneliness using a loneliness scale.
Hmm.
And we found of the 40 patients that we studied, all but three identified as being lonely. But we wanted to know, was there a difference in these genes being expressed between people that said they were very lonely compared with people who said they're somewhat lonely. So
Okay.
we did a comparison of those very lonely and those not so lonely, and we found that those who were very lonely, based on that scale, that kind of questionnaire, they had a distinct different expression of 18 genes
Mm.
that were inappropriately being expressed for this inflammation, which held the body in a high state of inflammation, which
Hmm.
is a very stressful thing. It affects their what we call the cortisol level. There's a lot of things that affects not only these genes, but it affects their immunity, as I said before, and it affects
Sleep.
growth factors and things that are
Yeah.
needed in wound healing and weren't able to get into that wound to progress it from, an inflammation stage to a healing stage. So
Right.
the wound just stayed highly inflamed the whole time.
Yeah. Right. And so there was no way it was going to heal. And so it wouldn't occur to, I mean, I'm sure that person, it wouldn't occur that maybe what was causing the body, because it's systemic, it's something inside them that is causing this reaction. Even the stress of their current condition might have been activating that stress. But they weren't going to get better as long as that activation was in place. And so then it goes to as a clinician myself, wonder what the intervention is, because I would think the normal interventions are compliance. Are you sure you're being compliant? Make sure you wear your compression socks. But it might be a different path. And so for somebody who's lonely, it is it was why I stated the definition at the beginning. Loneliness is that subjective feeling of being alone, even when you're not by yourself. And so it is something that's hard to assess. You can't just look at somebody and say they're lonely. Somebody could be not around other people for a year and be totally happy. But you might assume that person's lonely, as opposed to somebody else who's surrounded by people all the time and seems joyful, but they feel really alone. They might be disconnected from others in some sort of important way to them, or disconnected from selves, or just disconnected from the bigger meaning in life. And that disconnection is so profound for them that they're feeling alone in this world. And so, as a clinician, I would think it's very important to let people know that impacts your medical care, impacts your health. It's not just your emotional state, it's your physical state, probably your spiritual state, and how that might impact your capacity to seek help medically, um, and emotionally. So what did you find in terms of those people when you were working with them and started to understand those that were very lonely, their genes were different, their bodies reacting different. What did you find that did you find anything that was helpful to them? Were they able to?
Yeah, that's a really good question. When I spoke with you and the work you were doing with the veteran population, and what did you seem to find working? Because there's lots of things out there. That was what was kind of perplexing. But we also found, and I just want to step aside for 1 second. We also found something that had helped us think about the intervention or what we were going to try to do to help them. These folks felt very stigmatized. They worried that they smelled bad because of the drainage from their wounds. They had these weird shoes they had to wear, or
Mhm.
their legs were wrapped up. So they just had this appearance that they felt different, and people were looking at them. And many of
Yeah.
them, they had to use a wheelchair. Not a lot. I mean, some of them did, not many of them, but they just felt like they looked different and they worried about what people thought of them. So,
Mhm.
gosh, when we think about group, that the research shows that being in groups is something that is beneficial, but that's not what they wanted to be in. So
Right.
and then some of the other things like pet therapy and volunteering, a lot of the folks that we studied, and it had to do with where we were regionally, they didn't have um, transportation accessibility. Many of them lived alone.
Mhm.
So they were also lonely and socially disconnected.
Mhm.
So those are kind of two different, somewhat related things, though. And they said that they didn't have resources to be able to connect and go out and do things that, quote, society suggests. So, your intervention, that the cognitive behavioral intervention that you studied for a long time in different populations, and they were excited to be able to stay at home
Mm-hmm.
and have the connection that way. So
Mm-hmm.
they didn't have to get dressed and drag out and get, try to drive somewhere, get somebody to drive them. So, but before that, what we were doing in our clinics is I'm going to even back up further. They had no idea that they had this condition. They didn't have a label for it. They didn't
Mm-hmm.
realize when we started studying loneliness, they were surprised to even hear that word.
Mm-hmm.
They thought more about depression or low mood. And then when they started answering the questions and realized
Yeah.
this is loneliness. And we
Yeah.
told them this is a condition, like you said, it affects blood pressure and it is a true condition. The Surgeon General has labeled it 2023. A
Mm-hmm.
lot of work came out and a lot of social media around loneliness,
Mm-hmm.
especially after COVID. And it has changed us. It has changed us in ways that I'm not even going to try to attempt to understand societally, but our patient population suffered because of it. So what we did for these folks who identified as high lonely, I mean, I was worried about a score. The scores range from 20 to 80, and some of these folks were in the 70s, which meant they were severely lonely.
Right.
And it's a concomitant condition or a comorbid condition, so lots of other things with it. So we had social work
Mm-hmm.
see them when they came back for their appointments and talk to them about some, tech, whatever. I'm not sure exactly what the social worker was able to do for them,
Right.
but we initiated a social work consult, and then we embedded loneliness, 3 questions in the intake in our wound assessment. We focus on the wound itself, but we started adding questions, and I have them here. And this is a validated little scale. It's 3 items you see a loneliness screen. How
Mm-hmm.
often do you feel that you lack companionship? How often do you feel left out? And how often do you feel isolated from others? And there's a little scoring thing. But I just read a paper that the 1 question item is just as good, and that is, do you feel connected to other people?
Yeah.
And lonely, because it's such a subjective thing, the
Mm-hmm.
connected to lonely people takes away that somewhat subjectivity.
Mm-hmm.
If it's yes or no, then we would initiate some type of approach to them
Mm-hmm.
to mitigate that.
It's in terms of our work, the intervention, what we're noticing is that it's pretty insidious. I mean, j just like what you were talking about, people who there was a stigma, people who had these wounds, they felt there was a part of them that they didn't want others to see, or that others would judge them negatively, that they had this, that they might smell, or that it was dirty. And that is a key component of the work that we're doing when we intervene, is changing those thoughts about themselves. Nobody understands me. I feel alone. Nobody can connect with me, or I can't connect with other people. That can impact every relationship you have in your life, including the one you have that we've been talking about this whole podcast, is the relationship they have with their own body. It's even impacting the relationship they have with their own body. It's impacting the relationship they have with their place on earth as well as place with others. So the intervention in terms of a cognitive intervention, changing those thoughts, trying to understand that they can easily explain how they feel and how they feel alone and disconnected, and maybe a stigma or judge or worry about that. But it's it takes a minute for them to start to practice to change that thought. Because just because they have that thought, I'm worried it smells, I'm worried I'm different, that's not necessarily what anybody else is thinking. And the connecting with their whole person is very different than connecting with that one spot on their leg. You know what I mean? And so it does take quite a bit of work to help them modify or even consider modifying the thoughts that they have about themselves and their place on earth and why they're here and their thoughts on other people. If you feel damaged or dirty or diseased or different, it's very easy to push away from other people. And so even then, once you can change that thought, then you have to change the thoughts of, I want to connect with other people. They might have something to offer. A lot of people feel safe if they push people away. So then you have to even change the thought, people might be interesting instead of that person's weird.
Yeah, yeah,
You know,
yeah.
it is quite an intense intervention that we do, but a very, very important one because it's those core thoughts about their own self and their space in the world. But powerful if we can, if we can really change their thoughts on that, you can change their ability to connect with others, connect with themselves, and even heal their own body. Pretty profound work.
Yes, yes. I like how you describe that because I think for some people, when you talk about the therapy,
Hmm.
what is that? They go for wound treatment, and I know one of the wound specialists that I've worked with, she back maybe 10 years ago took a course on motivational interviewing because
Hmm.
she knew there was something else that was contributing to this healing issue. And
Hmm.
she and I talked about it for years. And then when I met you and learned about the work you were doing, she's like, okay, I've got to get training on this so that when I am working with patients, I can deliver, even if it's like a little brief session during
Yeah.
wound treatment, because a lot of these folks will be in treatment for 6, 10, 12 weeks, and sometimes it's twice a week. And can we as deliverers or providers, implement some aspect of this? We would never claim to be an expert in it, but is there little shortcuts or little things that we could do while we're engaging with the patient? And the other thing is too, what is this whole trend now with conversational agents? And
Hmm.
would something like that be appropriate? It's amazing to me. Everybody has a cell phone. I mean,
Hmm.
and most are all smartphones, even in the very rural areas. And um, I know there's a literature that there is some research that is emerging in this area. I don't know what the outcomes are because I don't think we know. But you asked about what do we do,
Hmm.
uh, and if we don't have access to mental health providers and we don't have access to sort of groups or other things, what could one do um, who's doesn't have access to
Yeah.
these things. So I don't know, what that looks like and what the future holds for that. But I
I
imagine,
I'm gonna put a little bit of a plug in. Even if whoever if you're the patient, if you're a provider, if you're a family member listening, if you can change that one thought to because all of us have been sick. Sometimes we get colds. You get a cold, you get a stuffy nose, and it's amazing to me when you get a cold and a stuffy nose, you're like, why do I feel so bad with this cold? It's just a cold. Why does it feel so bad? And then you have it for a couple of days and you hit that point where your brain starts to say weird things like, I am never going to feel better. I am never going to feel like myself again. That is a thought we all have when we're sick. I don't know why we have it, but we just get down. We don't feel good and we get whiny, I guess. But we do have that thought, like it just feels like you're never going to get better. I don't know if it's day 3, day 4 of a cold, but it's a very common thing that you just start to think, I'm never going to ever feel better again. This is horrible. This is my new normal. If you have some sort of chronic disease, it's very easy to say that to yourself. It's hopeless. I'm never going to feel okay. This is never going to heal. If you have a wound that should have healed and you still have it 30 months later, you can see how it would wear on somebody and they're going to lose hope. This is never going to get better anyway. If we can change one thing, so whether you're a provider, that person, or family member, change the thought, be open to having that thought of saying encouraging them, this can heal, that you can feel better. We can do stuff to make this feel better. Change that lack of hope to even just a little bit of hope wherever you can find it, and then keep dialing that just a little bit. That loss of hope, it can have profound consequences on somebody. If you feel like you're never going to get better, even with something silly like a cold, you're probably not going to have a good couple of days, but the cold runs its course, and then you forget that you had these morbid thoughts and you start feeling better. But if it's something more chronic, you can see how those thoughts get more and more depressed and less hopeful, but they're not necessarily true. And so be willing to even say to yourself, I could still do things to feel better. There are still options for me. And if we're hearing this podcast, loneliness, feeling disconnected from others, some of the solutions are finding ways to connect again, connect with yourself, connect with your purpose on earth, connect with others. You can be particular about who those others are. It doesn't matter. It can be one person that you feel really close to, but find somebody that you can connect to. It's worth it, and it can really change your whole life. It can change your physical, it can change your genes.
Yes, yes,
Yeah.
yes. And you are absolutely right. One of the colleagues that I worked with, she did a study in the very rural Appalachia
Hmm.
with older women, and her program was called Listen. And if I get this right, it's loneliness intervention using stories or story theory to enhance whatever it was. So
Yeah.
they connected through the phone, and that's all they had. They didn't have,
Hmm.
video, and they talked to each other and told stories. And it
Yeah.
was, I don't know if it was facilitated by my colleague, probably was, but she said the outcomes were incredible. And these women lived hundreds of miles from each other, but they connected through stories. So that was
Yeah.
kind of a interesting approach. Talk therapy, maybe. I don't know what it's called.
But it does show that there are options, and that it's not necessarily going to the doctor and or wearing your compression socks. Wear your compression socks. But but we have other options, and connecting with each other, feeling hopeful wherever you can, thinking about your place on earth and what you can contribute. Really um, important things to just consider.
Yes, yes, absolutely.
Hmm. And nobody thinks your foot is smelly.
No, they're treated. So the
Hmm.
treatment removes the odor, it removes a lot of the unpleasantness.
Hmm.
And that's why I was so, again, perplexed when all of these things were happening and the wound was getting the best, we call it the Florence Nightingale. It got the
Yeah.
best possible everything. And I would draw other blood to see, for example, not other blood, but I would look at other things like what was their nutritional status, what was their bodies, like were they have some sepsis or some kind, we
Yeah.
were looking for everything, even though that some of them had diabetes, and we controlled for all of those in the study because some of those conditions can cause inflammation as well and affect your genes, but these
Right.
genes are distinct.
Yeah.
Very different from those kind of genes that are disease oriented. We were looking for this particular pathway that was already well studied and well established.
Hmm.
And so we knew what we were looking for, and it wasn't just random kinds of things. I was kind of theoretical, but it was based on many, many years of study and lots of different, I would say, kind of biological or chemical experiments to find these particular genes. And then when 18 different ones popped out in our study,
Wow. Yeah.
our eyes flew wide open. And I taught when I finished the study and got the publications out, I called the patients and let them know, this is what we found and this is important for you. Um, and I present it in different places in South Carolina and also nationally, but I take my message to the community.
Hmm.
People know of these stories and they're like, that could be my brother, that could be my friend. She's suffered with this wound for years and they've not been able to do anything with it. She won't go out and she won't do this. And you think about what happens and
Yeah. Well,
the
what would your message be? If you could talk to a wider audience like you are right now
Mhm.
and say, if you or somebody you love has some sort of wound that is taking longer to heal than normal, than you would have expected, and you feel disconnected from others, what would your advice? What would you say to them?
I would tell them to reach out to if they have a close person. I don't want
Hmm.
to say a companion, a family member, even a neighbor that you see. It doesn't have to be necessarily someone who is, your best buddies with and I will say in the study, these folks said they did have someone that
Hmm.
they could reach out to. So it wasn't that they necessarily were so isolated from society, but they didn't know what to say. They didn't
Yeah.
know they knew how they felt, but they didn't have a label on it. And your work with the populations, they didn't like the word loneliness, so
Correct.
the intervention was called perceived social isolation.
Hmm.
So the thing about, feeling connected to people, if they're not feeling connected to anyone, but they do have
Hmm.
a network, like not a network like we're talking about, but a church community.
Hmm.
We found you might be surprised with this, that even in the rural areas, we thought they were going to feel the most lonely. That was not true. They were connected to a church or to fellowship or something, or they were going to a little senior citizens. One community that was super isolated, I thought physically, geographically isolated, the library van would go to their
Oh,
homes.
oh, nice.
And that's a connection. So I'm
Hmm.
long-winded here, but even having conversations or just touching base with somebody in the grocery store,
Yeah.
checkout clerks, we need to train them on some of these techniques because I know in my little where I grocery shop, some of the older people will wait until that clerk checks out people in front of her. Even though there's another clerk open here, they want to
Yeah.
talk with that one particular clerk. So
Yeah.
there's lots of different options, but someone who is listening to this and having these feelings of not being connected or being lonely, that one connection that they might have very superficial, that's a starting point.
Yeah, so even if they don't know what to say, it doesn't matter what you say. You can talk about your groceries or the weather. It doesn't matter, just that connection, that interaction with another person, being seen by another person, even seeing another person, having it be a mutual experience. Like, I see you right now. I think you're amazing. That's an amazing connection. We're doing it here, but it could be superficial. It could be your neighbor, and you're like, oh, this weather today. But you see each other. You acknowledge that you both are here. You're both important. You're valuable. You're worthwhile.
Yes. Call on the phone. I mean, I know that sounds, nobody wants, well, we text.
Hmm.
And I don't know if texting is a form of being connected, but I know hearing a voice and just that particular connection can change brain chemistry. I don't
Yeah.
know if texting does. I just don't know that thing, but hearing
Yeah.
another human voice who might be meaningful to you can
Yeah.
enhance brain
Or
function.
And even just having somebody listen to you. So it might not be receiving the text, but sending a text and then having the other person acknowledge what you said. So just being seen, just being heard, being valued for just, even if it's a couple minutes. I mean, hopefully it's more than that, but yeah, that matters.
Yeah, absolutely. So
Mhm.
I'm not sure that quite answered your question, but
You did. You're wonderful as always.
oh,
And so, do you have any last words you want to say to anybody?
well, I am not in the clinical setting anymore, and I'm in the academic side of things. And I think as friends and colleagues and just being, I like to be around people. And I think we, just by nature of what we do and who we are, need to be on the lookout for this. Even, in the grocery store, I use that as an example because I recruited a lot of people from the grocery store for my studies.
Hmm.
Um, and that sounds weird. How did I know? Because you can look at their legs and you can see that they have bandages on their legs. But just being social and going out of your way and mindfully being social to people that you think might not have those opportunities. And like you said, people like most people like to be heard or seen or acknowledged. And just that could change one thing just by saying, "Oh, hi, can I help you reach that?" Or
Hmm.
something that you find. You don't have to make it up, but even smiling at somebody, it sends this energy and this kindness that they might not have had in, a long time.
Absolutely. The world is not necessarily all hostile. There are friends out there.
Yes, yes, yes. So
And so,
that's not a very clinical or well researched response, but connecting to people purposefully, even though that might not be the, their intention, but we can reach out to others in ways that are unobtrusive and just very, very simple and very um I don't know, just that are connecting, just
yeah.
in a
Uh,
connecting way.
so just to summarize, we talked about a really huge big thing. We talked about loneliness, which is a person's ability to connect with others and feeling disconnected from others, even if they're in a room full of other people. The substantial impact that loneliness has on that person's body, physically, emotionally, spiritually. But today we were talking more about the physical aspects of loneliness. And I had said at the beginning it can lead to early death, and we talked about all the reasons why it can lead to early death. It's linked to a lot of chronic disease and inflammation and cortisol and depression, anxiety, and also a lack of hope. And so there are interventions that can help you if you're having a hard time engaging in that hope or engaging in connections with other people. There are interventions out there. If you want to learn more about them, please visit our website at choosinghelp.com. You can email me, Stecker at musc.edu. I'm happy to connect you with some work that we're doing. Um, I really am so grateful that you joined me here today. Thank you very much for your time and your wisdom.
Well, thank you for having me, and I'm so glad you and I connected because I think together we can make a difference.
We can make a difference. And so can you. We would like to hear from you. We would love to hear more from our community of listeners. Do you know someone who is struggling with a mental health condition and you would like to help them, but you're not sure what to say? Please feel free to get in touch with us. There's two ways that you can contact us. One is at choosinghelp.com. The other is you can email me directly. My email is Stecker, Stecker, at musc.edu. If you know somebody who's struggling, you'd like to get some help on how to help them, feel free to get in touch with us. We would love to hear from you. Also, If you know of some success stories, you know somebody who is struggling and they really worked through it, we would love to feature them. We would love to hear about them. Please feel free to share the stories of their success. If it was you, please feel free to let us know about your success. We would really like to know. We'd like to hear more from you. So choosinghelp.com is our website, or you can email me directly, stecker@musc.edu. Welcome to Choosing Help.